Today we're doing lower extremity stretches. So on your list that you have, you'll see that glute stretches are first. I don't really believe we need to do many glute stretches unless you're working with athletes, because the glutes are so weak they need to be strengthened. All of our extensors are like that. But if you're going to do glute stretches, just bringing your knee up toward your chest is going to stretch the glute. Most people won't feel it, and that's because their glutes don't need the stretch. Hamstrings, on the other hand, because of everyday living, because we're sitting so much of the time, hamstrings definitely need a stretch. I like to bring the knee up to the chest, and then while maintaining straight spine, straighten the knee, but keep the knee, straighten the knee, but keep your thigh toward your chest. Now, lots of people will do a stretch like this, and this is excellent. And if you keep the toes pointed up, then you'll often feel more stretch in the hamstrings. But what I find is that this stretch often hits gastrocs more, and people need more. So I have them take it to the chest and then straighten the knee until they feel it in the back of the thigh. If they start to roll over, that's not it. Now you can use a noodle to assist with this, and you can put it under the knee to assist, or you can put it under the ankle, but still, what you want to do is stretch out the back of the thigh. If you find that people don't have much flexibility in the hamstrings, you can use a technique called autogenic stretching, which means that you get into the stretch and then you try to push away from it, but you're holding it in. So I'm trying to push away from it, and you hold this for about 12 seconds, pushing, and then you get more of a stretch. So it's kind of like magic, and it's fun to do with clients, but you have to repeat it in order for that flexibility to stay in the muscle. So anyway, hamstrings definitely need stretching. While you're on hamstrings, you can bring the knee across toward the opposite hip, and again, you can do this with a noodle or without a noodle, and you will get probably maybe some piriformis, depending on where people are tight, because God strung us all up differently. Look at that noodle floating right back into my possession here, so that if you wanted to do this with a noodle, you do it like this. But here's the thing, what happens when I have my clients take their hip across toward the opposite knee, they turn that way, and then they're not going to get the stretch. So the other leg, the weight-bearing leg, has to be pointed forward, hip, knee, toes, and then that leg comes across. If you bring it up too high, you'll miss the piriformis, but you might hit something that the clients need. So play with it and see what works. Also, when you're in this, you can do an adductor stretch. You can do it with the knee straight, or you can do it with the knee flexed. You can throw the noodle under the ankle if you want, or under the knee. But what you want is the leg open. Open, and again, people will turn to it. If you turn to it, you're not getting the stretch. So your torso, your hip, knee, and toes of the weight-bearing leg have to be facing forward, and then the leg goes out, whether the knee is bent or not. And some people will feel a lot of sartorius here, but whatever they feel, they're getting the stretch that they need. Then people also ask me, what's a good quadriceps stretch? Quads traditionally don't need a stretch. Again, you can use your hand, you can put your foot against the wall to do this, you can throw the noodle under your ankle, and just, if your knee is pointed straight down and your knees are together, that would be the quadriceps stretch. If your knee is out to the side, it's not going to be any stretch. If your knee is forward, it's not going to be any stretch. So the knee has to be pointed straight down. But most people won't feel this at all because quadriceps aren't that strong. Then hip flexors are strongest muscle. It's the tightest muscle we've got. So with the hip flexors, stay in this position, keep your knees together, and then I have seen people go into lots of odd positions trying to get a hip flexor stretch, but what I've found best is I tell them to get into this position and then point their tailbone forward. And you always you'll start to feel the hip flexors, the iliacus and psoas, start to stretch. It's a pelvic tilt. It's a posterior pelvic tilt, but if I tell them pelvic tilt, they don't get it. If I tell them what to do with their tailbone, they know exactly what to do. So the knee has to be pointed straight down, and the knees have to be together. And then point the tailbone forward, and you'll start to feel the stretch. Okay, so that's hip flexors. External rotators, this would be the same kind of thing. Knee down, again, knee has to be down, because if you're trying to get external rotators, here it's not going to work. Point the knee in, and if people don't have this amount of flexion, use equipment or use the wall to help them. But this is just pointing the knee in. If you let the leg go out, you're not going to feel it. If you just let the knee point down, you're not going to feel it. Knee has to be pointed in. So you're doing internal hip rotation in order to stretch the external rotators, which for most endomorphic body types are not tight anyway. They might be tight on ectomorphs. Okay, so then internal rotators, same thing. Start with knees together, keep that knee pointed down, and then externally rotate that hip while keeping the weight-bearing leg, hip, knee, toes all pointed forward. And this should do it for you. Okay, so next are gastrocs. The gastrocnemius is very, very tight. So what I found is if I have my clients step forward, lift the toes of the back foot up off the pool bottom, they'll get the stretch, they'll feel it. Now, if they turn their toes out to the side, they usually lose the stretch. Now, you might find a different part of the gastrocs. Some people it might work for. Same with pointing the toes in. Most people will lose the stretch, but with the toes pointed straight forward and just lift the toes up, it's perfect. Now, lots of people ask me for a stretch for anterior tibs. Anterior tibs don't need a stretch. They need strengthening. But if you want one, stand on the noodle. Make sure that you don't fall in the water. And just point your toes forward. And there you've got your anterior tib stretch. And if you really want to push the gastrocs, drop your heels back until they touch the pool bottom. So balance in the middle, then touch your toes, and then get the gastrocs. This is excellent for ankle mobility also. So the other stretch that I'm just going to show you quickly today is a back stretch. There are a couple ways you can do this. First of all, you can lift one knee up, or if you're at the pool wall, you can bring both knees up. Then you round your shoulders forward, press your waistband back, and point your tailbone forward. So it's round your back, shoulders go down or in and down. Then point your tailbone forward, press your waistband back, and that should do it. The other thing that I've found works for people who have a lot of back pain is simply, I'll sometimes put their back against the wall and ask them to eliminate the lordotic curve. So simply flatten their back, and they do that again by pointing their tailbone forward. So flattening the back stretches the back, and then relax it. It seems so basic and so easy, and yet it works really well for people who have a lot of back pain. So I hope these quick 10 or 11 or whatever stretches help you have some ideas at the different pools that you work at, and I appreciate all the work that you do to help other people. Thank you.